Sahana Vavatu Sahana Bhunaktu Saha Vidyam Karavavahi Tejasvi Navaditamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. It's so nice to see everybody. What are the eyes made to see? Hmm?
Light. Light.
Sight?
Light.
Light. Okay. Anything else?
God. Nature.
Yeah, nature. Mm-hmm. Good. Yeah. Did you all get your cow dung bath this morning?
Yes.
You didn't get one yet?
No, I did.
You did?
They only let us do 4 a day because the cows have produced.
Only 4 cow dung baths? You're going to do 4 cow dung baths? Did you see better after the cow dung bath?
Was I supposed to?
You should get your money back if you didn't. Get a refund. It's really unique medicine. It's, if you have the opportunity to try it, because it's not too many places that you can have the cows that are being organically cared for, and there's no pesticides in the urine or the dung. It cleans the channels, all the subtle channels. It affects, we're rubbing it on the physical body, but we have 3 bodies, and it's cleaning all 3 bodies. So it's cleaning the causal and the astral and the subtle nadi channels, and it allows the prana to flow more fully. It expresses, so the breath of life that's passing through everything all the time, it can express more fully through this body instrument when the channels are clear and open and free. So that's sort of a principle of both Ayurvedic medicine and osteopathic medicine, that the channels need to be clear, the channels need to be free. And it's just like in nature. Because they're actually coming out with research now that when they dam the rivers, they block the channel, there's major environmental problems everywhere. Lo and behold, who would have thought, huh? So much so that now there's a movement to remove the dams. You can look on it online. They want to remove as many dams as possible because of the environmental consequences. So this is a microcosm of the macrocosm, and it's what's outside is inside. And Ayurveda and osteopathy are natural forms of healing. That means that we're following the natural laws of healing. Not only the natural laws, but the supernatural laws as they express into the natural world. So we can observe in nature the way to maintain balance. We can observe in nature the way to keep the instrument in harmony with the natural and the supernatural world. Right? We're going to talk a little bit more about osteopathy in these 2 classes because people have asked for that. And we have 3 really great Ayurvedic practitioners with us, and they're going to teach more on the Ayurveda, so we can talk a little bit more on the osteopathic side because people have asked to try to understand that a little bit more. Is that okay with you guys? Okay, because this is your time. We're here to support you in a journey of healing and learning, and so we want to do what is valuable for you and what's enjoyable for you. It's a really unique opportunity to come together in a group to heal, because that's where healing really happens. It happens in the context of wholeness because in pranada we say healing is what? Healing is a movement to wholeness. All right, so when we're in fragmentation and isolation, separation, that's illness and disease. When we're in wholeness, that's health. All right? So healing can't happen in isolation, by definition. It happens in the context of a whole. Even if you heal and you think you're healing individually, it's healing the whole dynamic of the creation. Your family circle, your community. So to function in a community healing, it's that much more powerful. And we support each other in that journey, in that movement to wholeness. One of the ways that we really do that is by seeing the health. What do I mean by that? Well, really one of the most important principles in osteopathic medicine is something that we call the health. It's in Ayurveda too, it's just a little bit, they talk about it a little bit differently, but it's there. So the founder of osteopathic medicine, Dr. Still, said, anybody can see disease. The true physician finds the health, or sees the health. All right? So what is the health then? It's the part that's perfect. It's the part that doesn't need any healing. It's the reference point that we're moving into. So in Ayurveda, they might say the Atma Prakruti, the perfect balance of the doshas that then your Prakruti doshas are referencing and then expressing in the Vikruti. So it's a scientific fact that there's something called the health, that there's something that's perfect. It is, really. If you look at the way that the body heals, it has to be so. Let's take an example. Let's say you have a cut on your hand, all right? So what happens then? Everybody says you bleed, right? Okay, so you bleed, but then what happens? Eventually it stops, right? All bleeding stops. Eventually. So then healing happens, right? So then this cut comes back together perfectly. It doesn't go halfway and stop. Now we're assuming that the body has what it needs to heal. It has a good blood supply, good nerve supply, good food, and a clean environment. It's going to heal back. It's not going to go part way and stop. Or it's not going to go all the way and then grow a whole nother hand, right? And then you've got 3 hands because you cut yourself a few times, right? No, it goes back to perfection every single time. So if you think about that, think about it and take the next step, that would mean there has to be something that's perfect that doesn't get disturbed when you are ill, be it an infection, a depression, an imbalance, a cut. There's something that's not disturbed, and there's something that's recognizing. There's some type of an intelligence that's recognizing this perfection and recognizing that the function is out of harmony with the perfection, and it starts to move it back into perfection. So that's the movement to perfection. Now there's something that's moving. So there is something passing through life, creating life, sustaining life, that has a divine intelligence. And it's a real thing. We call it the breath of life. And it's passing through everything all the time. Creating, sustaining, and destroying all the time in perfect balance and perfect harmony. Breathing, it's breathing us. And it's a real thing that we work with in osteopathy, and Ayurveda even works with it, because when an herb is prescribed, it's the breath of life that's being activated. It's the breath, the intelligence, the prana of that herb that is telling the cells and the doshas and the tissues, it's telling them what to do, how to respond. Okay, so it's a scientific fact. Can everybody agree there's something that's perfect in you? Can you admit that to yourself? It's a big step. It's a big step. There's something that's perfect. And it's not, that doesn't inflate the ego because it's humble. That perfection is perfect humility, perfect love. So we want to, then in a community, we want to see the health in each other. Right? It's easier to see the health in somebody else than in yourself. You're not supposed to see it in yourself. You're supposed to see it in yourself, but not yourself. Does that make sense? Right? So you're supposed to see it in your neighbors, in your community. And what we see and what we pay attention to, it grows, it gets stronger. And that's a scientific fact too. It's called augmentation. What you pay attention to gets stronger and grows. What you don't pay attention to diminishes. So if you spend all your time and energy paying attention to the parts that are not resolved or are problematic and no attention to the health, what happens? Right. Right. So we see this health, we appreciate this health in everybody and everything. And when you get an osteopathic treatment, that's what the osteopathic physician is really paying more attention to than anything, is the health and the perfection. Sometimes it's light. It looks like light, or it can be like a golden substance or honey-like substance. Or sometimes it's just a warmth, a tingling and a warmth. Sometimes it's just a joy. If you think back to what you were naturally attracted to as a child, sometimes that was an expression of the health. I liked to be in nature, or I always liked to swim. I was a big swimmer. Water. And so you think about that and you get in touch with that sensation, because this, what we're calling the health, it has a sensation. That's what's really important. It feels like something. It's a substance. It's the substance of life as it incarnates. So the breath of life that we're talking about, passing through subtle, is then incarnating. It's creating, and that's love. And it's breathing into something that's perfect, creating a perfect form that then comes out into diversity. So you have one substance breathing through all this diversity, but it's one substance. So if we can appreciate this unity amongst the diversity, it makes it easier to see the health, to appreciate the health. So when we're looking at our friends and our neighbors and our community, we can ask ourselves, am I seeing the health, or am I looking at something else? And so as we do that together, it starts to grow. It starts to grow. That's what the purpose of a community is for. Because now, everyone who's looking at you is seeing your gift. And your gift ideally should become your vocation or your job. You know, many years ago, maybe in Tetra Yuga or Sattva Yuga, when the child was born, the elder would look at the child, see the health, and know the vocation. Right? So there wouldn't be this big mystery about what am I supposed to do. And so somebody was naturally good with water, they became the person that always knew where the clean water was. And somebody else was naturally good with fire, they become the fire keeper. That was their gift. It was just naturally expressed through the health. And so we have this capacity, and we all have this gift that's expressing from your true self, from your health, that's expressing into the world. And that makes a community. Some people are just naturally good in the kitchen, And other people can't even heat a tortilla without burning it. Right? Yeah. Did you get to taste your herbs a little bit yesterday that came in your gift bag? Are you afraid of them? We had a really nice, they gave a nice discussion yesterday on the gift bag. And Triphala is a beautiful, beautiful herbal formula. That one is safe to take any constitution, any dosha. Yeah.
I heard you once on, it was a session, a Zoom session, you mentioned that, and that's very good for immune system, right? The Triphala, right?
Triphala is good for everything
For
almost.
everything.
Yeah.
One of the things I read, and that's why at the time I had some digestive issues, is it can cause diarrhea. Is that correct? So, how should you dose it then, and how should you do it if, for instance, that would be the case?
Yeah.
How, at what point would you take it, or how much? Or
Triphala,
I still have it at home. I bought it. But
there's some in your gift bag.
yeah, I saw that.
Yeah.
Already, yes.
Yeah. Triphala is a beautiful, beautiful herbal formula of 3 herbs, 3 fruits, Bibitaki, Haritaki, and Amalaki. And some places they call it the elixir of life because it has that much health benefit. If you mix Triphala in cold water, it tends to be a little bit more constipating. If you mix it in hot water, it tends to be a little bit more laxative. If you take it in small doses, it tends to be a little more constipating. If you take it in larger doses, it tends to be a little more laxative.
Okay. How about if you mix it in a porridge or something?
I wouldn't probably do that.
Just water. Okay. Okay.
Triphala works really nicely on an empty stomach.
Okay.
I didn't see it as one of the herbs that they have here.
We don't. Pranada doesn't sell it as a product of Pranada
Oh, okay.
because it's hard to grow the 3 fruits in this climate, and they'd have to get the trees going, and maybe in 20 years they would have the fruit.
Okay.
Yeah. So they don't sell it as a Pranada product. But you can get it from the Ayurvedic Institute, a great resource. Banyan Botanicals are both good, organic. The other beautiful thing about Triphala that I really like is it's therapeutic and diagnostic. And I love things that are therapeutic and diagnostic. I do. That's my favorite kind of medicine. Because it's curing and it's giving information about the cure or the disease or the imbalance.
How would it do that?
You taste it.
It's bitter.
Then you need more bitter in your diet. Triphala has all the tastes. Whatever taste you get is what's most missing in your diet. And many in the USA, many are missing the bitter taste. People don't like the bitter taste so much. So whatever taste you get, you need a little more of that to bring balance.
Why did you say that you stopped taking it when it tastes sweet?
Because now it's the sweet medicine. It's brought the complete balance. The sweet taste is not missing much in the diet. So if you taste sweet, it's complete. You're complete.
Then you stopped.
It's
taking
done its work.
it. Because last time we had this comment from me, afterwards I started taking neem in the morning, and then my Triphala at night started tasting sweet within 3 or 4 days. So, do I not need to take Triphala at that point?
Well, that would be hard to say because you're taking a single herb of neem that's going to be kind of bringing a different dynamic to your physiology. So I would say if you weren't taking straight neem and you tasted sweet Triphala, then, because the triphala may just be balancing the neem. I only got sweet taste once with triphala, one day. And I thought, oh, I'm done. But I said, no, I'm going to check tomorrow and see. I get sour a lot because I don't like sour much, so I kind of stay away from sour. Yeah.
Is it ever salty or is it more just
It could be. It has all the tastes. Okay, so we have this breath of life passing through, and it's wants to express, it's supporting us, it's healing us, it's maintaining us. But there's something that it really needs to do its best work. There's something that it really needs. And in osteopathy, we call that neutral. It needs a neutral. So the breath of life has 3 currents to start with. It has a positive current, a neutral current, and a negative current. It has a current that's active, a current that's sedentary or condensing, and a current that's neither of those two but unites the two. Okay? And so it's the same with our thoracic breathing. When we breathe in and breathe out, there's 3 currents. And if you get in touch with the neutral current, it's a sattvic breath that brings about peace and harmony and balance. If your mind is agitated, you'll naturally gravitate towards the active current. The breath will get faster, and it will actually rise up. It'll come up higher. It will. So when you're watching your breath, you want to get an idea of where the breath actually stops when you breathe in, because a normal conscious breath in a neutral person will go all the way to the toes and all the way to the head. It's like the breath comes in and it goes in every direction, and it passes through. You can actually feel it pass through to your toes, and you can actually feel it rise up to the head. And this is a true thing. We were doing an eye exam on this old sadhu yogi, and looking in his eyes, with each breath, his eyeballs were actually rising up a little bit. He was that neutral. He was that sattvic. He was that peaceful that the breath was raising everything up. So it was suffusing and raising. It was not hitting a barrier. But in most of us, because we're not so neutral, and we're expressing a little bit more tamas or a little bit more rajas and not as much sattvic, not as much neutrality, when we breathe in, that breath stops somewhere. And we often use the diaphragm as sort of the reference point for that. So we kind of get an idea, when we're breathing in, is the breath stopping at the diaphragm, above the diaphragm, or below the diaphragm? Just to get an idea. You can notice it in yourself right now. Maybe it's going all the way to your toes, but chances are it's stopping somewhere, and you feel that stop. And there's a reason for that. The diaphragm is a big deal. There's a little space embryologically, and even in the adult, there's a little space between, the diaphragm makes a little space between the lungs and the upper cavity and the abdominal cavity. There's this little space there. And that space is where, if you're anxious and you're sympathetic dominant, you have extra nervous energy going, that energy has to get deposited somewhere. The vata dosha, or the sympathetic dominant energy, has to get deposited so it doesn't cause more trouble in the organism. If all that charge went to the brainstem, you'd have a seizure. If it went to the low back, you'd get sciatica. So the first place it deposits is right in a very easy place in the seam of the diaphragm. And there's some major nerve plexes that pass through there, so it's very easy for that electrical impulse of the nerves to deposit into that seam. So it creates a sort of a rigid barrier that's not allowing the breath to pass through. So when you breathe in, you actually feel it stop somewhere. So what to do about that? Well, you could just push it down. I'm joking, it wouldn't work, okay? It wouldn't work. What you want to do is just start to notice the breath and accept it, okay? Accept it exactly as it is. And appreciate the breath. Just appreciate that the breath is directly connected to the breath of life. Your breathing of moving air in and out of the lungs and breathing in and out, your thoracic breath, your thoracic respiration, is directly connected to the breath of life. They are one. Krishna prana. Every time you take a breath in, it's Krishna prana, Mahaprana. So we come to that appreciation and just let the breath with a neutral observation, so not judging. It's not right or wrong, good or bad. It's just observing. It starts to change. Because our neutrality that we're talking about is directly connected to what we were talking about earlier, the health, your perfection. Your neutrality is a highway to your perfection. It's a direct connection. So what you observe with neutrality is being observed by the true observer, the health, and has then the capacity to change to its natural, normal state. There's healers that can look at you and you'll get healed. Because they're that neutral, they have that much love passing through, that what they look at transmutates, it changes. It's a true thing. I know some of them. You do too. Some of them are here. They'll look at you and you'll get healed. It happens a lot with children. If the child is still really innocent and the breath of life is passing through, they'll look at you and you'll get a healing. So everybody has the potential to be a healer at any moment. Now, if the breath of life is passing through you undiminished and you're neutral, what you look at will be healed. What you speak will be healing. What you listen to will be healing. All the five senses become the instrument of the breath of life. So you become the instrument for the healing. And that's what we're really made for. And that's the beauty of being in a community. Because if we all start to listen with neutrality, look, speak, and appreciate life with neutrality, now everywhere we're going, we're getting a healing. I had 3 healings this morning between the men's quarters and breakfast. Yeah. Because somebody was come out of meditation, they were that neutral and the breath of life was passing through, it hit me, lit me up. These are real things. And it's within everybody's capacity. But it has to be neutrality, so the sattvic current. So when you're receiving an osteopathic treatment with the osteopathic physicians, one of the things that they're looking to help establish in your treatment is a neutral. We call it a neutrality. So now the Ida Pingala channel become neutralized and the Sushumna opens. And your thoracic respiration, your breath is actually moving through that channel. That's a neutral breath, where neither the Ida or Pingala is overactive, they're neutral. When one is more active than the other, it creates a movement of prana between the two, and that blocks the Sushumna. But when we hit neutral with our breath, or in an osteopathic treatment, it naturally opens, the Sushumna naturally opens. just like in meditation. And then the breath can actually pass through that. And then the breath of life can actually flow through and move through unobstructed. So, where's your breath now? As we're just naturally observing, naturally watching, has it moved at all? It's okay to say no. As it starts to move lower, it's getting more neutral. As that stop point starts to move lower, it's getting more neutral, more sattvic quality. And we can just observe it and then let it be free. So just set the breath free. Does that make sense if I say just set it free? Mm-hmm. So you're watching the breath, and then we're just setting it free and say, okay, you do exactly what you want to do, how you want to do it. And watch it and let it change. As that stop point gets closer to the umbilicus and into the pelvis, you're getting more sattvic quality, more sattvic current out of the breath. Rajas and tamas are coming to rest and into balance. And it changes your whole physiology. It changes the whole physiology. Blood pressure, blood sugar, perception, all of it starts to change. Some of the herbs in that gift bag, they're there so that you can taste it and feel it and experience it. They're not necessarily made to be taken every day. You know, you wouldn't necessarily want to take the neem all day, every day, unless it was, you know, a specific prescription. And like Tanamai said, usually those herbs would be put into combinations to bring about a nice balance. But it's fine to taste it a few days and just, you can feel it. When your breath is neutral, you'll feel the effect on the prana that herb is having in your body. You can perceive more clearly what that herb is doing to the prana, because it's a prana mixing with another prana. It's a life force mixing with another life force, and it's telling the breath what to do. It's informing the breath how to behave, how to change.
Could you briefly mention the benefits of neem?
Benefits of neem?
Yeah.
Neem is a bitter herb. So you think about what the effect is of bitter, right? Bitter tends to have a lot of effect on the liver. And bitter taste tends to reduce the heat, right? So it will reduce the heat. It'll reduce the pitta. And it will be very beneficial for the liver and the skin, because the skin is nourished by the blood. And the root of the blood is where? Is it the liver? Yeah. So the root of the blood comes from the liver, embryologically and in the adult. So when you were a little embryo growing, in the liver was a lake of beautiful fluid. And when that lake started to flow, it became blood or plasma, rasa dhatu. And then rakta dhatu. So then it became plasma and then a red blood cell, and then it started to circulate all through the whole body. But it remembers its source as the river coming from the liver, so it has an intimate relationship. So what benefits the liver benefits the blood. What benefits the blood benefits the skin. So neem is good for liver, blood, skin, rashes, heat, as some examples. Mm-hmm.
You said that neem affects the breath
Mm-hmm.
in a positive way.
Everything affects everything.
Okay.
Everything that you take in
Yeah.
through any sense has an effect on your prana.
Okay.
Everything.
Yeah. Would you say it has a positive effect, or would you think it could be more like a stirring effect?
Positive and negative is going to be relative.
Okay.
So if your vata is high and you took a lot of neem, you might say it's a negative effect because you'll have more imbalance.
Okay.
But if your pitta is high and your liver is inflamed and you took a lot of neem, you may say it has a positive effect because you come more into balance. So if we say positive and negative, we're going to have to say it's relative to your point of balance. And tomorrow you're going to learn all about that in the Prakruti dosha and Vikruti dosha, what your balance point is. Your balance point is relative, it's different than anybody else's balance point. The breath of life created only one of you. There's only one Christian with that constitution. And so your balance point is different than anyone else. Now that's why it's going to be so beautiful when you learn tomorrow about the doshas. It's like the owner's manual for the car that you didn't get when you graduated high school for some reason. So then now you have a way to reference how the machinery works a little bit better, how to keep it in balance when it needs an oil change, and what kind of fuel it needs. Good question. It's relative to the individual's constitution. Yeah. So how's your breath? Is it getting any lower? Is it getting any more sattvic? More neutral? It should bring a sense of calmness as it starts to come a little bit lower towards the abdomen. It brings a sense of calmness, vitality, and clarity. So when you watch your breath, you can notice where the breath is, because it's going to tell you a lot about your state of mind and your state of physiology. If you're breathing in and you find the breath is all high and stopping up here, that's not a bad thing, but it probably means you're a little bit more in a rajasic state. You're probably a little bit more activated, more sympathetic dominant, which means you're going to have more of a stress response to life. And that's not a bad thing necessarily. You don't have to have a judgment about it, but just notice it and allow it to start to change by noticing it. Because the more neutral you are to anything that you observe, the more you're in contact with the health. And the more it will change on its own. What you pay attention to with neutrality changes for the benefit, for the movement towards wholeness or balance. Anything. Anything you want to change about yourself, if you can get neutral about it, without a judgment, and just watch it with that neutrality that's connected to the health, it will start to change. It's beautiful. It's really, and it's free. So I think those were the main topics we wanted to touch on today, was the health, the neutral, the breath. So when you get treated, when you lay down, the osteopath is maybe just going to be still and just listening a little bit. So they're listening for your health. If you want to understand anything, listen. Anything. I mean anything. If you want to understand it better, listen to it. Because listening, all the five senses are connected, each one is connected to one of the five elements. And so the listening is connected to which element? Anybody? Ether? Yeah. So the listening is connected to the most subtle element. So when you listen, you're actually receiving the most subtle essence of what's expressing. But not only that, you're receiving all of the other five elements because it comes back to source in reverse order. It comes from source into creation, from subtle to dense. It comes back to source from dense to subtle. So the first sense that's activated when you walk in a room is what? The smell. And that's the densest, connected to the earth element. And the most subtle is the hearing. So when you're listening to something, you're actually getting all the other elements are coming with it. All the other senses are coming with it. If you listen deeply, you'll get the totality of what you're listening to. You'll get a sense of what it looks like, what it feels like, what it sounds like, because it's bringing all the other elements. When you get to the most subtle, coming back to source, you're getting all of it at once, in one movement. So if you want to understand anything, listen. I sometimes listen to my breakfast. I do. It's amazing what you learn. If you want to understand neem, you take a little neem and listen. So when they're giving a treatment, they might be sitting there and it seems like they're doing nothing. They're listening. They're listening with their hands. They're listening with the totality of who they are to the totality of who you are, to understand how the breath of life is trying to move you into wholeness and how that can be supported. And so you get to just relax while you're getting that treatment. You don't have to do anything. So please don't do Kriya Pranayama when you're getting a treatment. Okay? I love Kriya Pranayama, and the treatment we want a little bit more neutrality so that something can come through. Just relax. You can watch your breath, that's fine. I just know it from experience because I've treated a lot of Kriyavans, and sometimes I'm there, it's like, nothing, and then I'm like, what are you doing? Kriya Pranayama, okay, knock it off. Just relax for a few minutes, and then the treatment can start. So you just want to lay down, relax. You can watch the breath. Don't worry if the mind wanders, restless, not restless, calm. It's all gonna settle out. If you fall asleep, it's fine. If you don't, it's fine. If you fall asleep and go into a sort of a deeper state, the practitioner may, when the treatment's over, they may leave the room. They may come back and check on you later, but if not, don't worry. They haven't forgotten about you or abandoned you. They're just letting you rest, okay? And if you wake up and you feel done, then you can get up and go. If there's no one around, you can get up and go. If you have questions, catch up with them later. Okay? So sometimes we'll just let you rest for a while because the treatment only just begins when you're on the table. Some treatments go hours, days, weeks, months, years. What's the longest treatment you've ever seen go?
I treated one of Jim's patients after he moved to Oregon. So it was
Decades.
yeah.
Yeah. But sometimes we give a treatment and then the person comes back a week, 2 weeks later, we can still feel that same treatment going. The person she's talking about who treated before she did was our teacher, our mentor. I received a treatment from him once that went 6 months. I could feel it. It would have gone longer, but somebody interfered with it.
Jim?
Yeah,
Okay.
yeah, you know Jim. Yeah, he used to.
How was it interfered with?
I got a massage from somebody who did cranial sacral therapy, and I fell asleep and they did something, I don't know what. And then when I came to, she said, "Oh, there was this thing down here, and I took care of it for you." I was like, "Oh, thanks." And I could feel it. It was it was done. It wasn't a bad thing. Nothing bad happened. It's just the treatment would have done more. She didn't do me any harm. It's just like somebody came along and snuffed my campfire out while I was in the tent resting, Yeah. You can restart a campfire. Yeah. So it wasn't like a big dramatic thing, but the point is, a treatment can last a long time. A long time.
Only if you're conscious of it?
No, if you're conscious of it, it's going to last less time. Because the one that's watching that is the one that's supposed to be getting treated. That's the part of the observer that's probably where the therapeutic force is trying to go to change that one. Yeah. 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 And then, are they getting a couple treatments, right? A few. So each one can build on the other one. And then you're getting Shirodara treatments too, which are really, really compatible, really harmonizing to this, because it's soothing all of the nerves and the subtle nadi channels that are in the head and brain, and that ultimately connects into the third ventricle, which is the cave of Brahman. So it's bringing a therapeutic effect to the seat of our consciousness in the physical form, and the seat of the immune system, and the seat of our perception. So it's highly beneficial to the whole nervous system, the immune system. It's really beautiful.
Is that a type of treatment that can last for a long time?
Mm-hmm.
In general, what would you say? Like, for somebody who's receptive, how long would that treatment last?
As long as they're neutral.
Because wouldn't you say sometimes, like, in order to unlock something, it just needs to happen once?
Sometimes.
It has no stopping force. It continues.
See, the breath of life is going to bring the perfect potency, the perfect tempo, the perfect temperature, the perfect effect for that person in that moment. And so sometimes, out of compassion, it's only going to treat it to a certain point. So you don't end up decompensated. So it'll treat it to a certain point, whatever it is. It could be a migraine headache, or anxiety, or constipation, or a sciatica. Whatever it is, it's going to treat it to a certain point. And sometimes then it's bringing the resource for you to create a new resource for yourself, a new level of balance, before it treats all the way through. So it doesn't take something away that will destabilize you.
Is that something you're conscious of while you're treating, is to not go too far?
It's something that the breath of life is bringing.
Yeah, but are you in control of that?
No. No, you can't control the breath of life.
I see.
The one that would say it can control the breath of life can't. Because that one is an effect of the breath of life. Right, so the practitioner is setting up the circumstances for the breath of life to express itself. And it's the same in Ayurveda. They're clearing the channels and bringing the organism into balance so the breath of life can come in and heal. Mm-hmm. There's no higher medicine. Because there's only one medicine, and that's the one that created. So now you have that which created you healing you.
As a practitioner, is one aware of how much of a vessel or a channel one is for the breath of life?
Yes and no. In the beginning, probably yes. Relative speaking, oh, that was good treatment, or I was really synchronized, right? But at a certain point, that I might disappear, and then there's not an awareness. You know, the most loving people don't know they're loving, right? Because the ones that love the most deeply, there's no I left, so they don't know they're loving. Right? So the answer would be yes and no. Yeah. The people that are transmitting the most love don't even know it. Mm-hmm. As soon as I know I'm being loving, it's cut in half right there.
So that's part of being the observer, the witnessing.
That neutral observer, that neutrality. Mm-hmm. Yeah, because that neutral observer is going to, whatever it looks at, is going to start to change. And so the vessel will get more clear, and the breath of life will come through more strong, until eventually there's nothing left for that observer to look at except itself.
Quantum physics, yeah.
And then it's all one. Mm-hmm. Yeah, it is. Yeah. And it's real. It's a real thing. You know, that's the foundation of Ayurvedic medicine. The foundation of osteopathic medicine is a wholeness to life that's being created by the breath of life that's passing through everything. And how do we cooperate with it? So if you're not feeling the breath of life, that's okay, because you are feeling your thoracic breath. And that's connected directly to the breath of life. And so then we look in the natural world and it starts to teach us. It teaches us how to live, how to be in harmony, how to heal by observing nature. Yeah. So we'll work with these principles and talk about these principles more as we go along, so we can build a synergy together that allows the health to be more palpable, more visible, more expression, and our sense of the breath of life may come alive, where we're feeling something that's passing through. So we have a little time left. Any questions? You guys have had a lot of good questions, but I don't have anything else I can think of at the moment.
Yeah, I had a question. You said the breath of life has a tendency to offer only so much of the healing, you know, as much as you.
The perfect amount.
The perfect amount, yeah. To an individual. Would you say that is directly correlated with the path of like realization as well? They do this. Is it the same process? You know, it seems to like give you just enough at the moment, and then for you to find the same thing. Would you say it is correct?
Well, look, anytime you take a step on any path, you have a choice.
Yeah.
Right? You can engage your willpower, or you can surrender to the breath of life.
Is that why we get tired too much? You know, because I feel like feel like I don't have as much energy as I would like, and I feel like probably a lot of us feel like that, but it's like just pure exertion for,
Yeah, the willpower absorbs a lot of energy.
yeah.
The ego absorbs a lot of energy. So if you watch your breath like we were talking about, if the breath is up high, it's under the influence of the ego and it's going to absorb more energy. If it's gone lower like we're talking about, it's under the influence of the natural state.
Yeah. Sometimes I just try to stay relaxed, and that's enough to do better, you know?
Yeah.
Scientifically, with the breath, yeah, that makes a lot of sense.
It's scientific through the physiology too, because when the breath is high, it's activating more of the sympathetic chain, the sympathetic ganglion, which is mostly in the thoracic spine and a little bit in the cervical. When it's down lower, it's activating the parasympathetics, which is the Ida channel, which is rest and digest. And when it's higher, it's activating the Pingala, or the right-sided channel, which is activity, rajas. And then when the two come into balance, when the breath comes down into the lower abdomen pelvis, those two channels come into perfect balance and the Sushumna opens and the breath passes through the Sushumna naturally. It's a natural occurrence, a natural phenomenon. So where the breath is a good gauge for how neutral you are and how much of the sattvic current you're picking up and how much willpower is being used in the moment. The willpower coming from the ego, not the natural will of the true self. When it's up high, you may be exerting an effect that's counter to the flow of life. When the breath starts to come lower, like we were talking about, you may start to perceive the sound of the breath. And the rishis tell that the sound is so-hum. So on the inhalation, there's a sound of so, and on the exhalation, there's a sound of hum. And so-hum is an approximation of that sound. You have your own personal so-hum. It's not exactly so-hum, but if you listen to the breath, there's something that sounds a lot like so-hum, but it's your own personal so-hum. So as that breath starts to come lower and you listen, you may hear the divine sound, and then as part of the divine sound, you may hear the sound of the breathing, which is something like so-hum, but a personal so-hum. So so-hum, you can chant it when you're breathing, that's a good start, but it's made to move us into a relationship with the breath where we're hearing so-hum as a natural sound of the breath, we're not chanting it. Chanting is fine, it takes us in the direction, but then you're going to drop that as the breath gets more and more balanced and more sattvic. You can drop it and just listen, and you'll hear this subtle so-hum. Merge with the divine sound. Very therapeutic. It's good for it balances the nerves, lowers the blood pressure. We have a lot of cases where we've taught people how to breathe, just a little bit like this, and they lower their blood pressure 20, 25 points without medication. Repeated results, not like a one-off, you know. So if you really want to understand anything, listen. Anything at all, any phenomena, any prana, you won't hurt anybody's feelings by listening. You know, you can hurt somebody's feelings by what you speak or how you look at them, right? Because those organs of action are a little more aggressive, potentially. But it's really, really difficult to be aggressive with listening, because listening is connected by nature to the ether element of space, which is the most humble of the elements anyways, right? In creation, ether takes no credit for anything, and it lets everybody else use it as its background. So I like to listen sometimes. I'm not always the best listener. But I try to remember to listen, because that's where we really learn. And it's very healing for people to be heard.
So I do have a question. How much time do you think we have?
How much time in this talk?
Yeah, I don't want to ask a big question.
10 minutes maybe?
Okay.
8 minutes?
So, if you have an injury, you know, that, say the person's middle-aged, and it's somewhat of a serious injury, I would imagine that at a certain point that, you know, physically you can only do so much. Physically only so much can be healed. And, you know, once you pass that threshold, then other things are going to get healed, but maybe there's still issues. Like, where is that all situational? Like, where that point is, you know, of if the body's going to recover? And then the second part of that question is, is the astral aspect and causal aspect of that injury, can that get healed even though the body's not going to, you know, cooperate?
That's a 20-minute question. Sorry, Jeremy. So, what did we say healing is? We said from pranada point of view what healing is at the very beginning. Oh, you weren't
I
here.
don't think I was here for that.
Yeah.
The movement towards wholeness. Healing, movement toward wholeness.
Healing is a movement to wholeness. And when you're in wholeness, you're healed. There's nowhere else to go. When you come home, there's nowhere to go. When you come back to your true self, there's nowhere to go and the search is over.
Okay, so that would be more of a spiritual aspect, overcoming physical.
So if somebody comes with a knee injury, that knee has lost its relationship to the whole of the organism. And it lost that relationship because there was a prior loss of a deeper relationship to wholeness that preceded that, if you're going to talk about cause. Now, how much can that injury be brought back into relationship to the wholeness is dependent on multiple factors. It's not the business of the healer or the physician.
I see.
It's the business of the physician to remove the obstructions and let nature do its work.
And then someday we'll get a golden opportunity.
And we don't know what will happen, and we don't know why. Because unless you know why that injury happened and the karma behind that and what's happening in the causal effect, you don't have the complete picture. So my input is faulty, right? Or limited. So then our job becomes anyways to remove the obstructions and allow nature to do its work, bring about the greatest level of balance. And then it may come up against a limitation. That knee injury may be what moves the person into a deeper level of wholeness within themselves.
Yeah, we were talking about that a bit at lunch, and you reiterated that positive and negative is so relative because you don't know where it's going. You can have some sort of thrilling experience that's going to end up, or vice versa.
Yeah. So don't lose sight of the sense of the whole. So that's a sensation. When we're in wholeness, there's a sensation. You know when you're in wholeness because it feels different than when you're separated.
So, under that.
So that's part of the benefit of a community is we start to get a sense of wholeness because now you've got everybody that's appreciating your health and your gift and not judging you. So there's a certain safety that the part that's has the illusion of being separate, because there's really no such thing as separate, there's only an illusion of separate. But that part causes a lot of trouble, that illusion causes a lot of trouble. But once that part feels a little bit of sense of safety or something that feels nice.
I have another quick question. If you,
Well, we didn't get through the first one. I told you it was a 20-minute question.
I'll save it for next time.
Good questions, Jeremy, good questions. You think a little bit like an osteopath. Maybe after you win the PGA Tour, you can go to school.
You know what? Yeah, I'm fine with that. I just want to see it happen.
Yeah. All right, any other questions?
Yes.
It has to be a 3-minute question.
Yeah, it's quick. You know, we hide the injury because of the ego. And so, you probably experience healings where it's literally just the acknowledgement of something that's, seen in a certain light that then, I don't know, takes care of itself. Do you feel like you have that power, as a healer to, because you can see, you understand the body and all these interworkings, so do you see an injury disappear just by, like?
If it's the will of the breath of life, it will change it, it will transmutate it. Mm-hmm. Mm-hmm. But our job is to cooperate with the breath of life. The more we cooperate in our life, in whatever your profession, the happier you're going to be. Whatever your vocation. Because that's really the vocation of everyone is to cooperate with the breath of life. And then you're in wholeness, and then you can appreciate the diversity that's coming out of the wholeness, that is part of the wholeness, but expressing as a diversity or multiplicity. Mm-hmm. Good. Well, right on time. That was a perfect 2-minute question. Thank you. So as we're getting some healing and some you can let it move through you because it will help everybody in the community and at large. You don't have to hold on to the breath of life. You don't have to hold on to healing. It's always passing through. And if we let it pass through, it comes through more strong, more potency.